I'm Julie and this is Caroline, and we're speech therapists here at Emory. As speech therapists, we work with dysphagia, also known as swallowing disorders, so you may hear that term often on here at the hospital. Today we're going to give you an idea of what dysphagia is and what to do with patients that are experiencing swallowing disorders. Dysphagia can be either oral or pharyngeal, meaning patients may have difficulty chewing their food based on whether they have weakness in their lips or their face or their tongue. They also may have difficulty with actual swallow function, meaning that it's having trouble going down the correct way into the esophagus, and therefore they may be coughing or having difficulty in this area or the pharyngeal area of the swallow. Many patients here at Emory experience dysphagia, and we see it fairly often here on the unit. It's really important to make sure that all the staff, including nursing, other therapies, are informed with what dysphagia is and the safety precautions that people need to take when working with patients that do experience dysphagia. Today we're going to go over different types of diets that these patients may be on, as well as the strategies and the precaution sheets that we use to help make sure that all of our patients are safe.
This green sheet can often be found in patients' rooms who have dysphagia. The speech pathologist will put it on the bulletin board across from their bed in their patient rooms. This sheet, bright green, it's to warn you that they have swallowing issues, and you should look at this when you walk into the room to see what they are. On the top of the sheet it will say the patient's name and their room number. In this top box it will tell you which consistency the patient is able to tolerate, which consistency of food, how much monitoring they need, what type of medications they're on, and what type of liquids they're able to tolerate. And we'll go over the different consistencies of food and the liquids in just a minute. This side of the sheet will explain how to set up the patient tray, whether it be to remove all trash from the tray or place all items on the left or the right, depending on the patient's preference and needs. It will also tell you how much time the patient needs to remain up after eating, how to drink their liquids, whether it be from a cup or a straw. Other notes may be written in this blank space, giving you more information about the patient and their swallowing. This side of the sheet gives you recommendations from the speech-language pathologist and the different strategies the patient is using. Some of these strategies include small bites and sips, alternating between liquids and solids, taking a sip to wash everything out of their mouth, clearing the sides of their mouths if they're pocketing food on the left or the right, putting their chin down after they swallow, or turning their head. And then the bottom, there's area for more notes. On the back of the sheet, you can find information about the different textures the patient is able to eat. The first texture the speech pathologist may recommend is a puree diet. A puree diet is like applesauce or pudding, or any food that's pureed. It does not consist of bread or lettuce or hamburger, it's all pureed food. The second level is dysphagia mechanically altered. Dysphagia mechanically altered can be likened to ground up meats with some gravy on it, like a ground up beef with gravy over it. Softer vegetables like canned green beans or steamed green beans, anything that's softer. Anything that's really fork mashable. You can't have any fresh fruit or fresh vegetables or bread on this diet. The third diet we use is dysphagia advanced. Dysphagia advanced is still the fork mashable type foods, something that's easier for a patient to chew and clear out of their mouth. They cannot have,
Wouldn't be fresh fruit, chips, hard candy, things that are hard and sticky and crunchy may not be placed on this diet.
And the fourth diet is a regular or a general diet, and that means no restrictions on their diet, any kind of consistency of food. We also have an edentulous diet, which is a mechanical soft diet that is not considered a dysphagia diet. It It is considered an edentulous diet, so patients that have or are missing teeth or use dentures and prefer softer foods may be on this diet. This is the green sheet.
Along with the green sheet, which is bright green, each patient that has one of these will typically, if they're on a restricted liquid, so if they're on regular liquids, this will not be the case. If they're on nectar thick liquids or honey thick liquids, or they are not allowed to have anything by mouth, they will have a bright green sticker on their armband, which will be placed around their wrist. This sticker will tell you the type of liquid the patient is on, whether it be nectar, in this case, honey, or this may say NPO, meaning nothing by mouth, so the patient is not allowed to eat or drink. This allows all the therapists and nursing staff and everybody in the building to be aware that this patient has liquid restrictions or dietary restrictions. Therefore, if they're up in the physical therapy gym upstairs and they want to drink, they know which type of liquid that this patient is allowed to have. Some of the other things that you might see if a patient is on a restricted, has restricted liquids in their room. These are the liquids that we use here that the patients may get when they need something to drink, whether on their tray or to take their medications. There are multiple types of liquid, as Caroline had mentioned. There's the regular thin liquid, which is what we all drink. There's a nectar liquid consistency, which has a green label. And then there's a honey thick consistency, which is a bright yellow label. It's really important to make sure you look at the labels, because giving the patient the wrong thickened consistency of liquid could cause them to aspirate or choke, and in turn cause them to get pneumonia. So it's really important to make sure that you look at both of the labels and you make sure that each patient is getting the correct type of liquid consistency and diet, and referring back to both the green sheet as well as the patient's armband and making sure that they match. If you don't have these type of consistencies with you, or there's not any on the floor, or the patient would like something that's maybe not pre-thickened to drink, we have thickener packets, which come kind of like this. The ones we use a lot are Thicken Up. It's basically a powder consistency that you can add to any type of thin liquid. There, on the back of this package, it has directions and it tells you how to thicken a liquid up to a nectar consistency and how to thicken it up to a honey-like consistency. So you would take a regular type of liquid, such as this is a cup of water. On the back here, it tells you that one of these packets, to thicken it up to a nectar consistency, you would add the entire packet to 6 ounces of water, which would allow it to be a nectar consistency. To thicken to a honey consistency, you would only add this to 4 ounces of water, so that it would be a little bit thicker. This is 6 ounces, right? So I'm going to add the packet. We're going to thicken to a nectar-like consistency. And take a spoon.
Or a fork. A fork can act like more like a whisk, but you can use a spoon or a knife.
You'll want to make sure to continuously stir, because sometimes it can clump up a little bit. Liquids that are really hot or have some type of carbonation, such as a Coca-Cola, may take a little bit longer to thicken up.
And the Coca-Cola or the carbonated beverage will lose its fizz. It might taste like a flat Coke. And after the liquid that has been thickened up with the thickening agent has been sitting for a while, 20 or 30 minutes, it may start to get thicker. It might get very thick, so what you can do is add some more of the liquid or add some water to thin it out just a little bit. Something important to remember is that when you're thickening liquids, don't add ice. When you add ice to a liquid that's been thickened, the ice melts and it thins out the liquid that you're trying to thicken. So if your patient is asking for ice water or some cold Coke or something along those lines, make sure you get it nice and cold before you thicken it. Do not add ice to a thickened liquid, because the ice will melt.